Namaste, I am Dr. Abhijat Sheth, President of NBMS, National Board of Examination in Medical Science, postgraduate medical education body in India. Today, we bring the initiative of CPR, cardiopulmonary resuscitation, to all of you to make sure that young cardiac deaths can be prevented during the critical time. As we learned that during the high physical activities like gymming, like running and other activities, young cardiac arrest happens. In such situation, CPR, cardiopulmonary resuscitation, can certainly make a difference and make sure that these young cardiac deaths are preventable. Cardiopulmonary resuscitation is very simple procedure to learn for all of you, and it requires the external cardiac compression during the cardiac arrest to ensure that the cardiac pumping continues till the patient gets an help from the ambulance or the hospital to revive them. It will certainly make a huge difference, and with the help of associations, with the help of emergency societies, with the help of faculties and the institutions, we are bringing this awareness together through our platform. And on behalf of the National Board of Examination, I extend my gratitude to Ministry of Health and Family Welfare, who has motivated us to bring this initiative to the community through our platform to ensure that the CPR training reaches to all citizens of India, to make sure that in recent coming years, the cardiac deaths are prevented. With this word, I give my best wishes to all of you. Thank you so much.
Does it make you nervous when you read that a gym-going fit person or a celebrity had a sudden collapse in the gym after a workout?
Is it not scary that while performing a dance in wedding or garba, someone collapses and dies?
Does it make you wonder why this is happening? And what would you do in a situation if a person would collapse suddenly in front of you? Do you worry why you hear of so many heart-related diseases in younger age groups?
Let us try to explain you why such things are happening and how a common man taking certain simple sequential steps can save a life in such scenarios.
Heart is a fist-sized organ that works like a pump in our body. There are 4 chambers in the heart that work in coordination. One chamber receives used blood from the body. Another chamber pushes that blood to the lungs for oxygenation. Another chamber receives the oxygenated blood from the lungs. And the 4th chamber pushes that oxygenated blood to the brain and other vital organs of the body.
Failure of the heart to pump this oxygenated blood to the different organs of the body leads to the condition which is, say, cardiac arrest.
Most sudden adult cardiac arrests are triggered by the development of an abnormal heart rhythm called arrhythmias, commonest being ventricular fibrillation. In ventricular fibrillation, the electrical impulses of the heart become chaotic, causing the heart to quiver and not be effective as a pump. Failure of heart to work like a pump will stop the circulation of blood to brain and other vital organs of the body abruptly.
The person loses consciousness and the death will ensue shortly. If we don't take action within 3 to 7 minutes, it becomes irreversible. Every minute delay will increase the chances of death by 7 to 10%.
A victim of cardiac arrest will become unresponsive. He will stop breathing or may have shallow, irregular breathing called gasping. He will not move and will have no pulse. Cardiac arrest can happen to anyone at any time, at any place, irrespective of gender or age. And you could be the witness and only one in a situation to save life.
Sudden cardiac arrest occurs without warning or within a few minutes of the onset of the symptoms. Effective immediate bystander CPR will improve the chances of survival by 2 to 3 times.
So what will you do if you witness such a situation? We are here today to teach you how to recognize a cardiac arrest and then how to take a simple sequence of steps, including using a commonly available device known as AED to save a life.
Let us start with a scenario in a reception area where a person who is standing in a queue feels discomfort and suddenly collapses. First thing that you do, ensure scene safety for both the rescuer as well as for the victim. We can't afford to have another victim because of unsafe environment like middle of the road, fire in the building, electrocution, drowning, and any such scenarios.
After ensuring scene safety, which might include shifting the patient from an unsafe place to a safe place, check for responsiveness. Tap the shoulders with both hands and ask loudly in local language, "Are you okay? Are you okay?"
Look around and ask a person to get the emergency kit and the AED, call for an ambulance and activate the emergency.
If no one is available, you can use your mobile phone to call the local helpline number and activate the emergency response system. In India, the local helpline number is 112.
While help is on the way, check for the carotid pulse. The technique of feeling the carotid pulse is feel for the trachea at the center, then slide 2 to 3 fingers at the side of the neck. Simultaneously, check for the breathing by looking for the chest rise. You should finish this in 5 to 10 seconds.
If you observe no breathing, abnormal breathing or only gasping, patient is not moving and you do not feel a pulse, start chest compressions immediately.
In the first few minutes, the oxygenated blood is in the circulation. So, we start always with the cardiac compression. For a layman, it is sometimes difficult to appreciate the carotid pulse. So, if the breathing is absent and the person is unresponsive, immediately again you start the cardiac compression.
The delivery of effective chest compressions is a priority, but if an AED is available, use the AED as soon as it is available. AED or automated external defibrillator is a lightweight, portable device designed specially for use by a layman. This device, when attached to the chest, can identify the abnormal heart rhythm like ventricular fibrillation, which can be treated by giving an electrical shock. This device can also deliver the shock, which will then convert the abnormal heart rhythm to a normal heart rhythm.
The AED uses voice prompts, lights, and on-screen display to guide the rescuer how to use it and prompt him. AEDs are simple to operate, guiding the lay rescuers and the healthcare providers to use it safely and efficiently.
In simple terms, AED is an intelligent device which, when switched on, starts giving voice commands. This AED, when attached to a victim's chest, can read and analyze the heart rhythm. This AED can also decide if that heart rhythm is also treatable by giving an electrical shock. If it finds that the abnormal rhythm is shockable, the AED will either deliver the shock automatically or will prompt the rescuer to deliver the shock by pressing the orange button.
AEDs are installed at public places like airports, metros, malls, stadiums, and many other places. Before you start chest compression, ensure that person is lying flat on a hard surface. Quickly remove the cloth and expose the chest, keeping in mind the dignity and the local cultural practice. We need to bare the chest because the AED pads has to be applied on the bare chest.
By starting compressions, you are initiating the CAB sequence of CPR. Compressions, airway, breathing.
Let us go through the steps of effective compression. Kneel down beside the victim.
Place dominating hand in the center of victim's chest, that is, lower half of the victim's sternum. Place the other hand on top of the first hand and interlock your fingers.
Keep elbows straight. Position yourself vertically. Pressure should be from shoulder and press the sternum at least 5 cm, but no more than 6 cm.
After each compression, allow complete chest recoil. Compress at the rate of 100 to 120 per minute. After you give 30 compressions, opens the person's airway and deliver 2 breaths.
Before giving breath, open airway by using head tilt, chin lift method. You can use a pocket mask if available or a barrier device. Mouth-to-mouth breathing can be given if you are comfortable or using a handkerchief. If you fail to deliver 2 breaths in 10 seconds, do not worry. Resume cardiac compression. This cycle of CPR should continue, and as soon as an AED or help is available, we should take the help of second person and use AED immediately.
AED operation has basically 2 steps. The step 1 is to switch on the AED, and step 2 is to follow the voice commands given by the AED.
The first rescuer will continue with the cardiac compression, while the second rescuer will operate the AED.
Place the adhesive pads on the chest of the victim according to the picture displayed on the AED pads. Place one pad on the right side of the chest just below the collarbone, and the second pad on the left side of the nipple on the left side of the chest.
After the pads are placed on the chest and the AED is plugged with the pads, it will take around 10 to 15 seconds to analyze the rhythm.
Analyzing heart rhythm, do not touch the patient.
If a shock is advised, it will charge and then it will prompt
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Pain. If needed, start CPR.
And do not remove the AED pads or turn it off. Ensure that the rescuers change positions every 2 minutes, preferably while the AED is analyzing the rhythm. This will help in improving the quality of compressions and prevent rescuer fatigue.
the device will repeat and analyze the rhythm every 2 minutes and prompt the rescuer what to do. This cycle of 30 compressions and 2 breaths will continue, and AED will keep on prompting every 2 minutes, and such cycles will repeat till the help arrives or the victim becomes responsive.
Let us summarize the steps of CPR.
Ensure scene safety.
Activate the emergency response system and call for help.
Confirm cardiac arrest by 3 things: unresponsiveness, absence of breath, and absence of pulse.
Start high-quality chest compressions immediately at the rate of 100 to 120 per minute, compressing at the depth of 5 to 6 centimeters.
Give 30 compressions followed by 2 breaths to be delivered in less than 10 seconds.
Never interrupt chest compressions for more than 10 seconds.
Use AED as soon as it is available and follow the voice prompts of AED for further CPR.
Continue the process of 30:2 compressions till advanced help arrives. By following these simple, basic life-saving steps, we can give the victim a chance to explore this beautiful world again.
Shed your inhibition and fear. Do CPR and save life.